I'm here at Morningside Eye, an ophthalmology practice in Sandton, where we'll have the pleasure of chatting to Dr. Darren Stoller, who owns these rooms. Now, what happens here? Why are we here? An ophthalmology practice deals with seeing patients that we as optometrists have referred here. Of course, patients do come here on their own as well if they have known diseases in their eyes, but we're going to go through seeing the things that get done here. So when you get referred by us, you have an idea what happens at an ophthalmologist practice. So let's go through and have a chat with Dr. Stoller, where he can introduce us to his practice and discuss all the exciting equipment he has here and how he can assist you if you have eye problems and you've been referred by an optometrist.
Morning.
Hi, how
Welcome.
are you, Dr.
Nice
Stoller?
to see you, Tania. Hi, how's it? Welcome. Have a seat. Thanks for coming.
It's always a pleasure to work with you for so many years.
Nice to see you.
So we're just here because we would like you to give us a rundown on your professional career, as well as give some education on what you do versus what I do, you as an ophthalmologist and myself versus being an optometrist.
Right, so being an ophthalmologist means I'm a doctor, going to medical school, finishing medical school, and then doing a specialty in eyes and eye surgery. So we're an ophthalmologist and ophthalmic surgeon. So we see eye disease, we treat patients who have vision loss or vision problems that can't be fixed with glasses. That's essentially what we do. So that partnership is very important. Usually patients, for the first time, their first contact with a healthcare professional that has any experience with eyes is their optometrist. So they go to the optometrist because they're having trouble seeing something. And the optometrist has a good look and examines, and if they can fix the problem with spectacles or contact lenses, wonderful. The patient never has to see me. But if for some reason the patient has an eye problem that cannot be fixed with spectacles or contact lenses, then they will have to come and see me. The optometrist will send the patient through to me. And then I have a good look at the eye from front to back. We examine the eye clinically at my microscope, which is called a slit lamp, and we do very specialized testing. We do microscopic photographs of various parts of the eye, and we find the reason why that patient cannot see clearly. And then we plan a treatment regimen to treat that problem. And once we've treated the patient, we refer the patient back to the optometrist for spectacles.
Have you been an ophthalmologist?
I have been an ophthalmologist now for 7 years in private practice. I graduated in 2012, and it's been an incredible experience being a private ophthalmologist in Sandton.
Are there any specific things you like to focus on or specialize in?
First and foremost, an anterior segment surgery, which means I operate in the front of the eye. I do cataract surgery, glaucoma surgery, I treat diabetic patients, I treat patients with age-related macular degeneration. All causes of vision loss, and surgery to treat that vision loss is my area.
In saying so, if a patient comes for a consult here, you still absolutely do examinations of the back surface of the eye?
Absolutely. We examine the whole eye front to back. We make sure everything's healthy. We check the retina. We examine for any changes that could be abnormal, that could be reducing vision. And we usually get referred patients from optometrists, and the optometrist cannot find a reason why their vision is down, or they see the reason why the vision is down, but they cannot fix it themselves with glasses or contact lenses. So they send the patient to us to see if we can improve the patient's vision medically or surgically.
Of course, in all cases, it's not possible. Sometimes there are factors that neither of us can help the patient.
Unfortunately, doctors are not God, no matter what some doctors may say, and there are some things we cannot fully control or fully treat yet. But every day medicine is changing and growing and advancing, and there's always something new on the horizon. So we always try and make sure we're on the cutting edge and that we give patients hope for the future if we can't help them today.
And in terms of your practice, I mean, I've worked with you, so I know that you have state-of-the-art equipment, that you're one of those gadget guys. You love all the new technology.
I love technology. I'm a computer geek, so this is my specialty, is geared. It's very technology focused. It's changing every few years, and I'm very proud to say I have some of the latest and best equipment here for ocular examination, testing. There's some very sensitive specialist equipment, very expensive to purchase and maintain, and to run an eye clinic is quite expensive, and that is something that We take a lot of pride in being able to manage and treat patients like some of the best practices across the world.
And what's great is that you've got theatre right here in your rooms as well,
Right,
just on one level up.
This is like a little eye hospital here. We have a laser suite in the back where we do refractive surgery, and then upstairs we have operating rooms where we do anterior segment surgery, cataract surgery.
And then the examinations downstairs.
Examination
So,
is all here. Yep.
excellent. Being in private practice myself for 14 years, we always have that patient who you send back to us and they make scenes that they don't want us to recheck their prescription. Can you tell us why you as ophthalmologists sometimes advise that the optometrists go through that again and check their prescription even after they've seen you with all this fabulous equipment?
Right, so there's various reasons. The first reason is that it's always good to have 2 checks. Sometimes prescriptions can change, varying slightly day to day or month to month, and it's always important to have a check. The second reason is the optometrist has much more experience and much more training in doing spectacle correction and glasses testing or refractive correction, refractive testing. So when it comes to myself as an ophthalmologist doing the tests, I'm happy to do all the tests, do the spectacle test as well.
Yes.
But the final responsibility and the final decision rests with the optometrist. And sometimes there are also pieces of equipment and training and laboratories that the optometrist has a relationship with that makes the spectacles that the optometrist needs to know what the correction is themselves and have to do the testing themselves. It's very important for the optometrist to do the test. We treat the eye disease, we fix what we can, but we do not dispense spectacles here as ophthalmologists, no. So we work hand in hand with our optometrist partners to dispense spectacles and also test for spectacles and do the refractive testing.
Yes, that makes sense. Thank you so much for your
Thanks
time.
for coming, and I'm just going to take everyone around. We're going to show you what happens in an ophthalmic practice, and we're going to see all the pieces of equipment and the machines so that if your optometrist refers you to see me as an ophthalmologist, you know what to expect.